So my name is Nabita. I am the course director for the Bachelor of Radiation Sciences, and I'm going to talk to you about this degree today. Okay. All right. So the Bachelor of Radiation Sciences is a 3-year degree, and we also have at the end of the degree 6 graduate pathways as well that you can opt for if you wish to do so at the end of the degree. In the Bachelor of Radiation Sciences, you will learn about the science behind medical radiation physics, image processing, and radiation treatments. You'll also discover and learn about different medical imaging modalities as well, such as CT, ultrasound, X-ray, nuclear medicine, MRI, and also radiation therapy. And alongside learning about the theory, you'll also get hands-on practice as well in our radiography and ultrasound labs on campus. At the same time, you will also learn how to collect, organize, and interpret and report health data as well. So you'll get some research skills in there. Now, what is radiation science? When I say radiation science, it's the study of the application of ionizing radiation in medicine. So, ionizing radiation in medical imaging, like x rays and CT scans, take detailed pictures of the inside of the body. Okay, and this radiation can pass through the body and create images that doctors or radiologists can then use to understand what's going on inside. Non-ionizing radiation, which you will also learn about, like MRI, does not use radiation, but instead a strong magnetic field around the area of your body. And this magnetic field makes the protons in your body line up in a certain way. So you'll learn how that works. And what the MRI machine does is it detects this released energy and uses that to create a detailed image of the inside of your body. Okay, so that's what ionizing and non-ionizing radiation is. Now, just quickly, I'm just going to talk about the ATAR, and this is information that is available to you online as well in the course handbook. So the ATAR for entry into the degree was 80 in 2025, so the lowest selection rank, and the lowest ATAR to which an offer was made in 2025 was 70. In terms of uh, subjects, so English and maths for Australian VCE. So units 3 and 4, or a study score of at least 25 in English or 25 in English other than EAL. And for maths, units 3 and 4 with a study score of at least 25 in one of math methods or specialist mathematics. Sciences, that's not a requirement. Same with the IB subjects as well. So you need English and maths. Okay, hopefully you can all see this slide. So this is the entire course mapped out onto this page. Okay, so you can see it's 3 years long, and we start off with a foundation year. Okay, so this is introducing you to medical physics, to foundations of anatomy and pathophysiology. There is a little bit of research and evidence in there as well. Health communication, you're learning about healthcare systems, you're learning about foundations of epidemiology. So the first year is foundational. In year 2, you then progress and you're learning a little bit more advanced anatomy, advanced pathophysiology. We also have fundamentals of cancer and its management. So you're learning about cancer management, patient care. You're learning about professional skills here as well. So we have professional skills 1 and 2, so communication, ethics, things like that. And you are also being introduced into radiography as well. Year 3 is even more advanced, but we're getting a little bit more specialized now. So here you're learning about the imaging modalities. Okay, so CT, ultrasound, MRI, and you're learning about radiation therapy as well. And radiation therapy is treating cancer, okay, treating cancer patients and managing cancer patients as well. So using radiation to treat cancer. That's what radiation therapy is. Okay, after completing the degree, you also have the option to enter into one of these degrees. And there are 6 graduate pathways. So most of our students, what they end up doing is they complete the degree and then they enter into the Master of Radiation Therapy, which is a 1.5-year degree. You can also enter into the Master of Public Health, Master of Occupational Therapy, Master of Social Work, Doctor of Physiotherapy, and Doctor of Podiatric Medicine. So there are options there available to you. If you want to do further study, you can enter into these programs. Okay, so this is where most of our students go into the Master of Radiation Therapy. And if you do intend to enter into the MRT program, some careful planning is required while you complete the Bachelor of Radiation Sciences. But I won't talk about this now, but just letting you know that there are some specific requirements and units that you need to complete in the 3rd year of your Bachelor of Radiation Sciences degree. And I've listed it out here, but I won't go through this today. Okay, alternative pathways. So those pathways I just talked about before, there are requirements. So you need to have a 65% average for the Master of Occupational Therapy, for instance. For the others, it's 60%. For Doctor of Physiotherapy, it's 70%. And for the Doctor of Podiatric Medicine as well, it's 70%. So just letting you know that there are requirements for entry into those programs as well. That's the WAM that you will need to score in the Bachelor of Radiation Sciences. Okay, and I think this is my last slide. So in terms of careers, this degree is a foundational degree. So once you graduate from this degree, you are equipped with a very diverse skill set, and that skill set then opens doors to various career paths. Okay, so in healthcare, in research, and in technology. So importantly, this degree does not confer registration as a healthcare professional, okay, but it does provide you with a solid foundation for roles that support and enhance medical imaging and radiation therapy practice, healthcare admin, research. So yeah, it is quite it gives you a broad skill set, and if you want, there are also opportunities for further specialization via the graduate pathways that I mentioned in the previous slide. So if you wanted to, look for careers, complete this degree, and then look for careers, the types of careers, I'm just listing some examples here. In research and development, you can become, for instance, a research assistant, clinical trials coordinator, radiation safety officer. There are healthcare support roles as well, healthcare and admin and management roles. So for instance, I did advertise this to Bachelor of Radiation Science graduates. There was an admin assistant role in the medical physics field, so that would be suitable. Project coordinator, being a research analyst or a policy analyst. In the medical equipment and technology field, medical equipment sales, technical support specialist, product development assistant, and in the public health and education field as well, health educator, public health analyst. So these are all very broad and diverse areas that you could go into because this degree allows you to get into these types of roles. Or you can finish the degree and then get into, for instance, the Master of Radiation Therapy, where you then do become a registered healthcare professional. So you become a registered radiation therapist. And I'm sure I'll get questions about that afterwards. So I'm happy to answer those. And that's all from me today. Thank you very much. And I look forward to hearing your questions.
Thank you, Navita. That was great. Great information. Someone's asking, just a quick question. Someone's asking, can they go to the Master of Medical Ultrasound from this course?
Yes, so I've had this question before. Technically, yes, you can. We don't promote the Master of Medical Ultrasound now because one of the requirements to enroll is to have a training, clinical placement training position already. So you need to secure that before enrolling. So that is one of the requirements. Yes, you can, but you do need the clinical placement, unfortunately. You need to secure that yourself.
Okay, thank you. Yes, that's a challenge for all students applying for the Master of Medical Ultrasound. Regardless of your background, you do need to find your own placement provider. And there is this one question which a lot of people are going to ask, so we might as well get it out of the way. And they're asking, like, can you pathway from, and how do you do it, from the Bachelor of Radiation Sciences into the Bachelor of Radiography and Medical Imaging?
Yes, okay. So again, it is a possibility, but it is not always guaranteed. So there are limited places in the radiography degree because they have clinical placement requirements. So these things are assessed on a case-by-case basis, and you also need to have achieved a certain WAM as well. And I was hoping John would be here to talk more about that, but I can get more information from him and pass that on
That's
to
fine,
maybe,
Navita.
yeah,
Yes, John hopefully will join us in a bit.
yeah.
So that's fine. Someone's asking too about the entry requirements. Are they fixed? Are they certain? Well, it's true. Admission requirements not fixed. They're asking about the difference between sort of can they come in with general maths instead of math methods? So while our entry requirements do change every year, there can be differences with the ATAR requirement, and sometimes we do change our prerequisites. Generally, like, they don't change that much. So if currently we're saying math methods is required, then it's most likely you'll need math methods. And there's usually a reason we ask for math methods or a higher maths for a course. And that's usually because it has a higher maths requirement. Like, there's quite a bit of maths in the course, or there's some physics in the course. So if you did come in without it, we are concerned that you might struggle. So, our aim at Monash is to give everyone a good experience, make sure everyone gets through the course and can do well in the program. So we don't want any students to come in underprepared. And so that's why we have prerequisites, which mean that you're well prepared, you're able to cope with the work and what you need to do. And currently that requires the higher maths. But please always check our entry requirements before you apply on the Study Monash page, because they do change from year to year, even if sometimes just fractionally. Now, I'm going to see if John's here. John, are you with us? So I think maybe John's having a bit of trouble joining us at the moment. So what I'm going to do is I'm going to throw to Chris first to talk about his personal experience studying the Bachelor of Radiation Sciences. Now, Chris, you are in third year, is that correct?
Yes, I'm a third year student for the Monash Radiation Sciences degree currently.
That's great. And do you want to tell us a little bit about your experience in the course?
Absolutely. Throughout the whole course, just in a nutshell, the cohort is relatively small compared to most degrees. But the upside of that throughout all the years is that you have a very close relationship with pretty much majority, if not all of your students. And it's a very holding hands, supporting environment that you're kind of put in from the start that just gets more and more tight as you go throughout each of the years. When it comes to the content itself, in first year, as we said before, it's very broad. We go through a lot of general biology, general physics in regards to radiation, and some healthcare research. As you go through that, you'll be put with people that may be in other courses as well, as these are broad subjects. Hands-on experience for the first year is probably the highlight of the experience compared to previous, as you're given a lot of engagement within the classes during the first year, especially for biology. For an example, in regards to anatomy, we had flagship races where we were given prompts of anatomy subjects, and you had teams of people to just notify, test, and analyze the biology that we were discussing. Second year is a bit of a jump, but it's manageable in a sense, where we therefore go and pass down the knowledge that we've learned from first year in regards to anatomy and radiation and apply it for aspects of X-ray imaging, CT, and general radiotherapy, trying to get more concise. The jump within third year is probably the biggest that I've had currently. We are about to do a first week of placement, which lucky enough for our course, we are actually given options for our placement. We don't have to seek it ourselves. So we're very fortunate enough that they provide it for us, which has made the experience a lot easier. And as the classes get smaller, especially in third year, you find it that you rely on your cohort together as you're working through the year and getting past the content. And one thing that I've noticed is that everyone's at the course for a different goal, but everyone still achieves it together. The experience with teachers itself has been phenomenal in my experience, where when semesters end, you feel sad, you're taking photos with the class. And yes, sorry. Just one quick note in regards to radiation sciences that I would say has been the biggest highlight was in regards to just being supported by the teachers throughout the entire process, as they understand the coursework and what workload that we go through, and allows us to obtain the knowledge as we go along, because it's important to uphold that as it gets further and further advanced as you go throughout the course.
Thanks, Chris. In 10 years' time, I'm sure I'll remember to unmute myself before I speak, but still muting myself as I go. So thank you. That's really good insights into the course, and it's really nice to hear that how that you're given that support. Like you're now a mentor, and obviously you've got people mentored you during your early years, and you were felt supported, and that really helped you progress through the course. So that's fantastic to hear, and it's really good support. Now I'm going to quickly throw to Maddie. John's on the way. He's got caught up taking some X-rays, and I'm going to throw to Maddie. And Maddie's currently a fourth year radiography and medical imaging student, and she's going to talk about her experience in radiography and medical imaging. Over to you, Maddie.
Hi, thanks for that, Tim. So yeah, I'm fourth year, which our total degree, I'm sure John will explain this more, but not having heard his part yet, it's 4 years in total, our degree, so I'm in the final year now. And I've just got some pictures here to go through today to help you see what the student perspective is like. So starting with the classroom experience, that first image, the top one, that's me in a lab. We have a radiation lab where we get to practice positioning our fellow students. That's one of my students there, and we like role play different scenarios. I think they have a C-spine collar on there, so maybe it's a trauma thing. And I think I'm taking an ankle X-ray, but we don't actually take images of the students. We have phantoms for that. So it's a plastic man-shaped object with real bones in there. So you can actually practice taking X-rays, changing factors, changing positioning to see how that affects our images. And that's how we learn. And it's great for hands-on experience. That's 100% biggest takeaway is the labs, learning from hands-on experience. And that bottom image, that's how we probably conduct the rest of our studies in a tutorial or workshop environment. So this is the LTB, And you can see there are circle tables, and it's really collaborative a lot of the time. Similar to what Chris was saying, our degree is relatively small, about 60 students as well. So you know everyone, you get along great, and it's very much everyone helping each other through everything. And yeah, it's also good to get other people's perspectives. We talk a lot about different like patient presentations and different difficult cases we could encounter, and hearing other people's perspectives is invaluable. It's great, the learning environment. But there's also a lot of flexibility with online teaching modules as well. So there's a bit of everything. And then our placement structure, I'm not sure if John will go through this maybe a bit more, but in first year, you get 2 placements. It starts at 2 weeks and then 4 weeks. Second year, there's also 2 placements and 4 weeks, 4 weeks. And third year, it's 6 weeks, 6 weeks. Last year is 6 months in total. So it progressively gets more and more as you go throughout the degree. And there's kind of a different focus each year on what you're learning on placement. So that first image there, that's a hand x-ray. That's an example of an image you might take first time around. You do a lot of extremity x-rays, feet, ankle, legs, arms, etc. And then by the end of first year, you can pretty much take an x-ray of the entire body. So it's really great getting out on placement. We go on placement first year, first semester, which I think would be pretty rare with other health degrees. And it's amazing to get that first hand experience, interacting with patients, seeing your practical knowledge applied, and like gaining an understanding really early on if you actually like this career pathway that you're on. And then second year, that's an example of a theatre machine there. So we go into theatre, we have the full scrubs, PPE and everything, and then you have your leg gowns that you wear. So we go into like other areas outside of the department, the radiation department. It's our role to make sure that everyone is radiation safe, and that's a big part of the whole degree, radiation safety. And you also do mobile x-rays, so that's where you go out on the ward and you can take usually a chest x-ray of a patient in their bed. So I think the interesting thing about second year is you get to see a lot of different patient presentations. So we see a patient is under anesthesia in theatre, or maybe they're really sick. That's why they can't come to the department to get their x-rays done. So you go to the ward. Also the intercollaborative work that you do with the nurses, the theatre techs, the surgeons. I think that's really awesome part of second year that you get to develop there. Also with second year, there's a big focus on like patient factors and stuff, and we learn about pediatrics that year. And yeah, that's really interesting year. Third year is then more advanced imaging modalities. So you get to practice CT, which is that bottom image there, MRI and ultrasound. And yeah, and you get hands-on experience in all those areas on placement. And it's good to get lots of variety on. And then over to the opportunities, there's endless opportunities for you in this degree. Our placement structure, everyone gets to go through a bunch of different sites. So you get to go rural, everyone has to go rural. You go metro, you go to public hospitals, private clinics. And I think it's just great that everyone gets to find the niche or the area that they enjoy the most. I went to Ballarat for my rural placement. That's a picture of it there. And I loved it. I loved it so much that I decided to go back there for my big 6-month placement, which is coming up at the end of this year. And yeah, it's great to get a different perspective from what you'd see in metro areas. Over on the very right there's a picture of Hobart. One of my friends got to go to Hobart for their placement. So yeah, just showing there's interstate opportunities to go. At the bottom there, that's me at Royal Children's Hospital. So you can apply for specialist centres like that with pediatrics. Me in front of the meerkat enclosure they have there. And it was just lots of fun, but also completely different and difficult working in that environment. And it was such an invaluable learning experience there. And then finally, that last image, that's me in Cambodia with 2 of my fellow radiography students. And we got the opportunity to go over summer for 3 weeks to Cambodia as part of a cultural immersion program that was with 30 other health students. So it was an interdisciplinary thing. And yeah, it was amazing. We got to talk with like NGOs, we got to do site visits to hospitals there, and it was just amazing. And then I really took back with me a sense of like being culturally sensitive in my care and how can I best serve the patients that we treat and help. And I hope that's a good overview.
Thanks, Maddie. That was a terrific overview. Fantastic. I've got some questions. You mentioned a bit about placements there, and there was definitely some questions. And Chris, feel free to jump in too with radiation science experiences. People asking, do you get paid for placements?
Unfortunately, no. I will say though, there's a caveat there. Our last placement, so similar to Chris, we get allocated for all our placements for the first 3 years. And then our last one, which is the big 6 months, we apply for that. And some places will pay you. Public hospitals, no, I will not be getting paid. But I do get accommodation paid for in rural. A lot of rural places pay for accommodation. But some private centers, you do get a stipend. So, but usually no. Yeah.
Okay, nice. Chris, did you want to add anything to that?
Yep, I do believe this is important to note as well. Same as the radiography course placement, from our knowledge, is not subsidized with any sort of payments whatsoever. So the out-of-pocket cost in regards to travel, uniform, immunization requirements, police checks that you'll have to do for your placement will become out of pocket, and you'll be notified of that earlier on to plan ahead.
Okay. All right, good to know. Yeah, and the accommodation, if you go to Ballarat or if you're somewhere else, do you get accommodation near the hospital where you're working? No?
It depends place to place. A lot of the time, the university will suggest housing which is nearby, which is more affordable, I think, usually in the range of $50 a week, maybe. I don't want to, that's a generalization. I'm not entirely sure for everywhere, but that's what Ballarat was at least.
Okay. Chris, did you want to, I see you want to.
Yeah, in regards to my placement on the first week, we had the subsidized allocation spots that we can hire. I'm going for the one in Traralgon. However, it was fully booked, and the subsidized cost is different depending on how many weeks you have. But it is, in a case of accommodation, a much more affordable option than finding your own rental for your placement as you go along.
Okay, that's good. Good to hear. All right, thanks, Chris.